Pramipexole is a medication that is used in the treatment of Parkinson's disease. This medication is classified as a dopamine agonist. It is available as a tablet to control Parkinson's disease. Pramipexole has few advantages. It has low side effect profile compared with other medications. It is rapidly absorbed from the GI tract with high bioavailability. It has no interaction with food, so it can be taken either with food or without food. It is mainly eliminated as unchanged by excretion in the urine, and it has less metabolism, therefore it can be given to people with liver impairment. It is a non-ergot dopamine agonist, so it is not having the side effects of ergot derivatives. It has neuroprotective effects. It can inhibit the apoptic pathways and it can produce antioxidant properties. It can reduce the oxidative stress, thereby it prevents the degeneration of dopaminergic neurons. These are the various advantages of pramipexole which can be used for the treatment of Parkinson's disease. However, this medication has few limitations like sleep attacks. So in this video, let's discuss all such facts and complete information about pramipexole. First, let us see the clinical use of this medication. Parkinson's disease is a condition that is associated with motor disturbances. It involves a few symptoms like tremors in the hands, which may also progress to arms, legs, and jaw. People may have stiffness, particularly in the arms, legs, and trunk. Another symptom is the bradykinesia, slowness of the movements, and they may also have some rigidity in the movement. Poor balance and incoordination are also observed. People may have difficulty speaking and even loss of memory. They can also have weakness and sleep disturbances. Lack of dopamine is one of the key factors for the development of Parkinson's disease. In order to control these symptoms, pramipexole can be given, which improves the dopamine transmission, thereby relieving the symptoms of Parkinson's disease. Another clinical use of pramipexole is in the treatment of restless leg syndrome. It is one of the neurological disorder in the people that causes an urge to move their legs. They may feel uncomfortable without moving their legs. They can also have unpleasant sensations like crawling, aching, and tingling sensation in the legs. Particularly, these symptoms may be troublesome during the night, which may disturb their sleep. They may also have fatigue during the daytime. Pramipexole can modify the dopaminergic pathways, thereby it can control the symptoms of restless leg syndrome. Now let us see the mechanism of pramipexole. Parkinson's disease is a neurodegenerative disorder that results in motor rigidity and slow movements. One of the main reasons for Parkinson's disease is the loss of dopaminergic neurons in the brain. Dopamine has several roles in the body, particularly it controls the muscles. When the control of dopamine is lost, it may lead to loss of muscle tone and imbalance. Particularly in the nigrostriatal pathway, loss of dopaminergic neurons may lead to the development of Parkinson's disease. Now, pramipexole is a dopamine receptor agonist, specifically activating the dopamine receptors at the striatum and substantia nigra. It has high selectivity on the dopamine receptors like D2 and D3. The selectivity of D3 receptors is 8 times more than D2 receptors. By activating these receptors, it can act like dopamine and improve motor functions. D3 receptors are also present on the presynaptic neurons as autoreceptors. When they are activated, they decrease the oxidative stress, which reduce the damage to nigrostriatal pathways. In this way, pramipexole can improve the symptoms of Parkinson's disease by increasing the dopaminergic transmission. Now let us see the precautions of this medication. Use of pramipexole may lead to sleep attacks, particularly during daytime. People may fall into sleep suddenly during the daytime, which may increase the risk of any accidents. Without any warning signs, pramipexole may induce excessive drowsiness and people may fall into sleep suddenly. This may impair the daytime activities. Particularly, it will be troublesome when they are under conversations, eating or driving vehicles. Such types of effects can be observed even after 1 year of treatment with Pramipexole. Generally, people may have somnolence or sleepiness with use of Pramipexole. However, these sudden sleep attacks may disturb their daily activities. Therefore, before using this medication, caution should be exercised. This drowsiness and somnolence may be further increased by other medications that produce sedation. Even consumption of alcohol may also increase the somnolence, leading to sleep attacks. Few medications like cimetidine can increase the plasma levels of pramipexole, which also increase the sleep attacks produced by this medication. In the activities that require more alertness and consciousness, the use of pramipexole may be discontinued. In the activities that require more alertness and consciousness, the pramipexole may be discontinued. Even though higher doses may induce the sleep attacks, reducing the dose may not completely eliminate the risk. Pramipexole can also produce orthostatic hypotension in the people. Since it is a dopamine agonist, it can increase the dopamine activity, which produces a drop in the blood pressure. This is particularly observed when you change your posture. This orthostatic hypotension is particularly more observed when you increase your dose. Therefore, during the increments of doses, you should be careful. Using the pramipexole at higher doses than 1.5 milligrams for 3 times may not add any advantage, and it is not beneficial. However, at such higher doses, side effects are more pronounced. In people with renal impairment, pramipexole should be carefully given. This medication is going to be excreted in the urine as unchanged. Therefore, in people with renal impairment, the levels of pramipexole may be elevated. The dose of pramipexole may be reduced in people with renal impairment. However, in case of severe renal impairment where creatinine clearance is less than 30 milliliters per minute, the use of pramipexole is not recommended. Pramipexole may increase the risk of dyskinesia. It is a condition of involuntary muscle movements. It may involve a few symptoms like rapid eye blinking, lip smacking, and twisting of tongues. Pramipexole can increase the dopamine activity as a dopamine agonist. Therefore, it can increase the risk of dyskinesia in the people. Particularly, the pre-existing dyskinesia is further increased with use of pramipexole. This medication can increase the psychotic behavior and it may lead to hallucinations. Since it is a dopamine agonist, it increases the dopamine activity that may lead to psychotic symptoms. The increased action of dopamine on the mesolimbic pathway may lead to few of the psychotic symptoms, leading to hallucinations in the people. Pramipexole can also produce compulsive behaviors. It can cause increased urge to spend money and binge eating. This is because of increased dopaminergic transmission within the CNS, which increase the neuronal modification leading to compulsive behaviors. In such conditions, this drug should be discontinued. Now it is the withdrawal symptoms of pramipexole. This medication should not be stopped suddenly as it may develop a few symptoms called withdrawal effects. On sudden stopping of use of pramipexole, it may lead to the development of anxiety, depression, fatigue, insomnia, sweating, pain, and apathy, lack of initiation. Therefore, this medication should not be stopped suddenly, and if it is required, it should be discontinued by gradually reducing its dose for at least a period of 1 week. Even sudden stopping of the dose may lead to development of neuroleptic malignant syndrome. In such conditions, people may have elevated temperature, muscle rigidity, altered consciousness, confusion, and rapid heartbeats. This neuroleptic malignant syndrome may be observed on sudden discontinuation of pramipexole. When pramipexole is used in people with restless leg syndrome, it may result in a rebound symptoms on sudden stopping of its use. Now let us see the side effects of this medication. One of the most common side effects of pramipexole is the somnolence. It can also produce some dizziness and lightheadedness. Other side effects like nausea, constipation, dry mouth, and upper abdominal pain can be observed. It can also produce hallucinations, insomnia, sleep disorders, fatigue, and peripheral edema. Few people may also observe muscle spasms and vertigo-like symptoms. Dyskinesia is another common side effect that results in involuntary movements. Postural hypotension can also be observed with use of Pramipexole. Now let us see how to take this medication. Pramipexole is available as immediate release tablet as well as extended release tablets. The extended release tablets are to be taken only once daily and they can be taken either with or without food. However, these tablets should not be crushed, chewed or divided. They should be swallowed whole because they contain a special coating that releases the medication gradually. The immediate release tablets are available at different strengths starting from 0.125 mg to 1.5 mg. On the other hand, extended release tablets are available from 0.375 milligrams to 4.5 milligrams. For the treatment of Parkinson's disease, it should be started at low dose. In case of immediate release tablets, Pramipexole is started at a dose of 0.125 mg given 3 times daily. The dose can be slowly increased on a weekly basis to a target dose of 1.5 to 4.5 mg per day given in divided doses. In case of extended release tablets, Pramipexole can be started at 0.375 mg per day. However, these tablets should be given only once daily. The dose can be increased after 5 to 7 days at an increment of 0.75 mg per day. For the treatment of restless leg syndrome, Pramipexole is given at an initial dose of 0.125 mg given 2 to 3 hours before the bedtime. The dose can be increased at an interval of 4 to 7 days by 0.5 milligrams per day. So that's all about this medication, Pramipexole. This medication is a selective dopamine receptor agonist which has more selectivity towards D3 receptors compared with D2 receptors. However, it can activate both D2 as well as D3 receptors, which improves the symptoms of Parkinson's disease, and it also reduces oxidative stress and increases the neuroprotection. This results in the decreased loss of dopaminergic neurons and improvement in the symptoms of Parkinson's disease. However, this medication can induce the sleep attacks during the daytime, leading to sudden falling into sleep during daytime. It can also produce drowsiness and sleepiness in the people. With these precautions, Pramipexole can be used to control the symptoms of Parkinson's disease because it has several advantages like high bioavailability, less metabolism, and low side effects profile. So that's all about this medication, Pramipexole. So that's for today. I hope this video is useful to you. If you really like this video, please subscribe to our channel and hit the like button to support our work. In our next video, we will come with another interesting topic. Thank you for watching. See you in the next video.